Okay. Hello, my name is Garrett Akers, and I'm the co-president of the Environmental and Sustainable Health Interest Group here at the Health Sciences Center, along with Christine Nguyen. Thank you for joining us today for this environmental health and environmental justice talk entitled Creating Environmental and Health Policies in collaboration with our friends in Norman. So before we begin, I'd like to read OU's land acknowledgement. Long before the University of Oklahoma was established, the land on which the university now resides was the traditional home of the Caddo Nation and Wichita and affiliated tribes. We acknowledge this territory once served as a hunting ground, trade exchange point, and migration route for the Apache, Comanche, and Kiowa and Osage nations. Today, 39 tribal nations dwell in the state of Oklahoma, and as a result of settler and colonial policies, that were designed to assimilate Native people. The University of Oklahoma recognizes the historical connection our university has to its Indigenous community. We acknowledge, honor, and respect the diverse Indigenous peoples connected to this land. We fully recognize, support, and advocate for the sovereign rights of all of Oklahoma's 39 tribal nations. And this acknowledgement is aligned with our university's core value of creating a diverse and inclusive community. It is an institutional responsibility to recognize and acknowledge the people, culture, and history that make up our entire OU community. And now I'd like to hand it off to Christine.
Thank you, Garrett. Again, my name is Christine Nguyen. I am the co-president of the Environmental and Sustainable Health Interest Group here at the OU College of Medicine. It is my pleasure and also my honor to introduce Dr. Nation, or Professor Joe Nation, or Joe, to speak with us today. A little bit of background. So Professor Nation, he's a professor of the practice of public policy at Stanford, where he directs the graduate student practicum in public policy and teaches policy courses on climate change, healthcare, and California state issues. He also serves as the Grossman Kennedy Fellow in Human Biology, teaching environmental and health policy. He was also representative of the California State Assembly. During his tenure, Dr. Nation authored 50 bills that were enacted into law. In the Assembly, he focused on legislation that improves education, the environment, healthcare, and transportation. Now he dedicates his time teaching students of his knowledge and biking to campus. I'm very, very happy to present Dr. Nation, someone that I very much admire and I like to call my mentor. Dr. Nation.
Great. Christine, thank you. And Garrett, thank you very much. It's great to be here, virtually at least. I guess you guys are, probably like us. We've been doing this for about a year, about 3 months to go, and hopefully we'll be back to some semblance of normalcy by the summer, or certainly we'll be there in the fall. The president of the university just announced no commencement again this year, which I know is a big disappointment. Hopefully you guys will, maybe there's a way to make it work there. I know it's so important for people to go through that ceremony. So let me share my screen, and I'm going to talk about my experience to a great extent as a legislator before I got to Stanford. And I've actually been at Stanford. I can't believe it. It's actually been, I think it's my 14th year now. I started teaching, I left the assembly in 2006 and started teaching at Stanford in 2007. And it's just been, it's just a really wonderful place to be for a ton of reasons. So let me share my screen. Here we go. Okay. All right, so you guys should see that. And again, I'm going to talk about health and environmental policies with impact, or at least trying to design those policies that have impact. Full disclosure, I am a native Texan. I grew up really hating OU. I'm so sorry for that. I hope you guys aren't offended by that. But I grew up near Dallas, a city called Richardson, if anyone's from the Dallas area. So just north, a suburb just north of Dallas. And my maternal grandparents actually were from a town called Oakland Union. Some of you who are, in the sort of the I guess I'll call it the southwestern part of Oklahoma, may know that city. It's near Frederick, is in the Oklahoma side. Anyway, Oakley Union is literally about 3 or 4 miles across the Red River. And so as a kid, I used to, we'd go up there and it was just great to be in the country and so forth, although the summers got pretty hot, as they still do. And I think, for whatever reason, I think everyone in Texas is pretty much a Longhorns fan, so I apologize for that. I describe myself as a recovering politician. I did 14 total years in politics, 8 at the local level, then 6 in the California State Assembly. And as Christine noted, I really focus on education, environment, energy, and then I sort of I'll describe this a little later, I turned and did some work on healthcare. It didn't go very far, which I will describe, but it was a good experience. I think hopefully we paved the way for people later. I think I'm only the second person in California to have a PhD in public policy or an advanced degree of some kind. I shouldn't say that, public policy, or and actually serve in the legislature, either in Congress or the state legislature. There's a guy named Tom Campbell was sort of, he actually taught at Stanford as well. He's a dean of a law school down in Orange County now. And I tend to be, a policy wonk as much as I can be a policy wonk. That doesn't always work in the political world, and we'll talk about that a little bit today as well. So what I want to do is first talk about sort of lay the groundwork for what I think a lot of people sometimes sort of overlook, and that's the fact that there really is public support for what some people would call progressive environmental and health policies. And I really don't like the word progressive, honestly. I thought liberal was fine. I thought whatever was fine. But there really has been pretty consistent support across the country, and I have some polling data on that will show the consistent support over time for environmental protection and for expansion of health insurance and healthcare. So we'll start off with, again, sort of this discussion of public opinion. As you can see, if anyone falls asleep and wakes up halfway through this discussion, you'll see down here at the bottom, I'm going to go from public support to case studies to climate imperatives or international climate policy. Okay, so we'll start with this. And what's really interesting about this is that this light green line shows the percentage of people who think that the environment should be given priority over the economy. And as you can see, back in the 1980s, there was a huge gap, really big gap, where, for the most part, people said, if you got to choose the environment. Now that, it became smaller and smaller over time, and you can sort of see that what actually happened was that it got to where it was actually negative, where people actually said, take care of the economy first, and that was because of the Great Recession. And very often there's this perceived trade-off, at least. I don't think there is a trade-off. That's something for another discussion. But generally, people have said, take care of the environment. It's important to me, and so I'll start off with that sort of baseline public support. I also want to point out that, and again, this data only goes to 2020, but you can see that today, and when I say today, that's 2020, this was probably done pre-COVID, pre-pandemic, but the numbers are pretty lopsided. About 2 in 3 people said, if you've got to prioritize the environment over the economy. So again, pretty consistent support across the way that people have expressed over time. Some other important data points. Most Americans think that humans are causing global warming. And anyone who has studied the science of this knows that's a fact, but there's so much mis and disinformation out there that there's still a little bit of confusion. But I wanted to sort of show this and show the percentage of people by state that believe that the warming is or has been caused by humans. And so, not surprisingly, in California, it's about 88%. But you may be surprised that the number in Oklahoma is 77%. So for the most part, across the country, you can sort of tell by the scale over here that 60 to 90% of people generally believe that warming has been caused and is being caused by humans. So you wouldn't think that from the policies we've developed. You wouldn't think that from the political or the popular discussions that occur. But there's really consensus on this. And so I hope that that suggests that we'll be able to move in the right direction on this. So along the same lines, following on this global warming or climate change issue, most Americans actually believe that government should do more. Most Americans believe that federal government in particular should do more to address global warming. So people think it's caused by humans. People actually think that, I don't have a slide here, but there's some data that show that people actually think it's going to be potentially bad outcomes. And so people have sort of stepped up and they actually have said, no, I think we really should do more to take care of this problem. So even, in a place that is more conservative in California, certainly in Oklahoma, about 2 in 3 people believe that the federal government should actually do more. So again, I think that's a good sign. And it sort of begs the question, if so many people, believe that global warming, climate change is a problem, is caused by human, government should do more, why aren't we doing more? We can talk about that in the Q&A, which I'll leave plenty of time for, because I have some thoughts on that. But again, overall, if you had a national election and people could vote, should we do this or should we not do this with respect to climate change and global warming, we would do something. We would take some pretty aggressive action. So hopefully we'll move in that direction, not too far in the future. So I also wanted to broaden this out and look at the general support that Americans have, not just for climate, but for environmental protection. So you can see the third one down this list, reduce effects of global climate change. 67% think the government's doing too little. Implicitly, I know there's some question about whether this is the right conclusion, if you will, given the language here. But generally, people believe that we should have more environmental protections. 2 and 3 think we ought to do more on climate change. About the same number think we ought to protect air quality. Roughly the same number support water quality and so forth. And so you can sort of see that there is general support across the board, regardless of which environmental issue you pick. So people actually want to do more. So switching to health, because I wanted to fold in this health care and health insurance concept. Americans also overwhelmingly support universal health care coverage. Now, I may be, if those of you who are in the med school or working on healthcare issues there, this may be sort of second nature. You might say, well, of course, everyone should have healthcare, everyone should have access to care. That's not a universal concept, but if you look at the polling data here, it says that this is the percent of Americans who think the federal government should be doing more to provide health insurance. So the total here is 85%. That was in 2006, but it's been between 74 and 85% over this time period. It has gone back from 2006 to 2019. So again, more than 3 in 4 Americans think that we ought to do more on that. And it's fairly, strong. There's less support among Republicans. It's below 40% now, in part because of opposition to the ACA, which is interesting. I'll get to in a second. But generally, people support this. So again, my conclusion is that Americans generally support greater environmental protection, generally support expansion of health insurance and health care and health access. But we're not doing that. So again, we'll be able to talk hopefully at the end about why we're not doing that. So I wanted to point to some specific provisions within the ACA, the Affordable Care Act. So again, and the font's a little bit small on this, but hopefully you can read this. And I'll just highlight a couple of these. So these are elements of the ACA that people support. And so you can see that the total support is in this column, and starts off at 72%, goes down to 51%. And I just want to focus on two of them. And the first one is prohibits health insurance companies from denying coverage for people with pre-existing conditions. I think everyone kind of knows that there's broad support for that, even among Republicans. Over 62% support that. People don't want an insurance company to be able to cherry pick and only insure healthy people for obvious reasons. Another element of the ACA prohibits health insurance companies from charging sick people more. In other words, you can't discriminate in terms of the policies that you issue. So again, 64% total, 55% among Republicans. So even people who oppose the ACA generally, or political parties like the Republican Party, generally support these provisions that exist, the two key provisions that I think people associate with the Affordable Care Act. So again, I want to at least start and just kind of provide that background in terms of public opinion to give you a little bit to be able to discuss these, what I'm calling case studies. So the case studies I'm going to look at, so I'm going to do health and then a couple of environmental ones, and then we're going to end talking about specifically about international climate policy, sort of what I think we need to do and how we can do it. So let me start off first by highlighting, Christine mentioned that I had 50 bills that were signed into law. I had a lot of others that weren't signed into law because I tended to be pretty aggressive, and I tended to be fairly ambitious in my goals. And so I was in the legislature from 2000 to 2006. Remember that Obamacare, the ACA, wasn't enacted until 2010. And so back then, not many people really dared to venture into the, into this subject. Not many people talked about healthcare. At the time, if you were a Democrat, your position essentially was, let's just have a single payer system, a single insurer system like they do in Canada. If you're a Republican, the position was essentially, it's not our business, we should just let people take care of themselves on this. So a little more on the background of this attempt to get to universal healthcare. Again, the backdrop is that most people, the majority of people, believe that we should have universal healthcare access in the US. California has actually toyed with this idea of single payer for almost 30 years now. There was a ballot measure. I don't know if you guys should have looked. Like, I don't know if you guys have initiatives or ballot measures you can place and have a statewide referendum. In Oklahoma, we do a lot. In California, this was placed on in 1994. It failed miserably. Remember, this was right after the Clinton healthcare proposal failed. And it sort of fed into that, the opposition fed into that, and so it failed miserably. There have been lots of other attempts. It's almost always single payer because Democrats control the legislature, and Democrats are in the governor's house right now. And so for, again, about 20 something years now, it's been sort of this single payer or die mentality, unfortunately. There's another proposal this year, probably not going to move forward. And it's probably not going to move forward because there's no funding for it, et cetera. But people kind of like to do what a friend of mine calls virtue signaling. They like to sort of suggest that they're in favor of this wonderful plan that'll ensure everyone, it won't cost anyone anything. And of course, there's no way to get there. But that's sort of the backdrop of what's happening here in California. So again, continuing on how not to do universal health care. So that first slide showed, this attempt at single payer. So I had a really good friend in the legislature, a guy named Keith Richmond, who was a physician from Southern California, a Republican physician from Southern California. And he and I got, to where we worked on issues because, even though I represented a fairly liberal district in Marin and Sonoma counties, it's the counties just north of the Golden Gate Bridge. you know, I think it's important to try to reach across the aisle and try to get stuff done. So anyway, so Keith, again, a physician, and he actually came to my district, and we had just done a workers' compensation reform package, and that had been done. And I brought him there to talk to people in my district about that. And as we were driving back from something I was driving, he was in the passenger seat, I said, well, what do we do next? He said, how about healthcare? And again, it was something that people just didn't do. People stayed away from it. And I said, yeah, what a great idea. You know, what a great way to end my career. And Keith as well. Keith actually ran for a higher office and lost. I did the same and lost, in part because we didn't sort of toe that, you know, I didn't toe the Democratic line of single payer. He didn't toe the Republican line, which was let's just ignore healthcare, let people fend for themselves. But we thought it was important to sort of put a stake in the ground, if you will, to try to move us in the direction of universal care. So we introduced a series of bills, actually 6 bills altogether, starting with Assembly Bill 1670. And we did things that were not that common. They were discussed a little bit, but no one ever dared suggest them. We actually suggested and required an individual mandate that everyone would have to have insurance. We required insurance companies to issue insurance, whether they wanted to or not, something called guaranteed issue. We were essentially trying to force the use of EMRs or EHRs, electronic medical or health records. We looked at seismic safety because hospitals here traditionally have had problems because they have these very old facilities that fall down during earthquakes, and we occasionally have earthquakes, so we provided some relief there. We proposed establishing something called the Center for Quality Care that would essentially evaluate the efficacy of certain treatments and drugs and so forth. For California, it wouldn't be mandated coverage or treatment, but it would be recommendations that the government would do that people hopefully would listen to. We tried to move people who are on Medi-Cal, which is our version of Medicaid, onto generic drugs. And the last thing we did was we tried to expand advance directives so that you wouldn't have this huge amount of spending at the end of life that you all often have. So at the end of this process, so Keith and I went around the state and we had these big meetings, 200 and 300 people coming to listen to our proposal and so forth. And by the end of that, everything we proposed, with the exception of advance directives, was shot down. And it was shot down because on the Democratic side, it was single payer or die. And on the Republican side, it was, oh my gosh, you actually might have to raise taxes to do this. So Keith, again, a Republican, proposed a very tiny gross premiums tax. So if you were to an insurance, health insurance provider, you actually pay that gross premiums tax. It would have raised about $1.5 billion, kind of a small amount of money in California, but that was enough to sort of tar and feather him and hurt him along the way. So, again, this was not the way to do it. I'll describe in a second why this failed. And this is sort of a broad theme that I have for today. Bipartisanship is really hard. And it was hard when I was there, when I left 16 years ago, or 15 years ago, 16 years ago for this bill. And it's probably even harder today, whether you're in the state legislature or you're in Congress. It is next to impossible to reach across the aisle. And I think it's really important that we do everything that we can do to get there. Again, Democrats are obsessed with single payer. It's single payer or die. I was actually censured by my local board of supervisors because I voted against a single payer bill because it didn't have any funding, which seems logical that if you're going to spend $100 billion, which was the price tag at the time, you ought to have funding to pay for that, right? Which was fine. That was their decision, not mine. And again, Republicans are obsessed with taxes, and maybe some people would say with Democrats, and some people would say Democrats are obsessed with Republicans and so forth. But at any rate, it's really tough to get things done. it was really hard because we took on some powerful interests. You know, healthcare is 18% of the economy, nearly $1 in $5. A lot of people rise up and, you know, because they want to protect their share of that 18%. And then the last thing is, I think that we were kind of, we may have been a little bit too early. So Keith, again, my physician friend, actually died about 2 years after he left the legislature, unfortunately. His chief of staff called me during the Obamacare debate, you know, on Capitol Hill. He said, "What do you think of the debate on the nation Richmond healthcare bill that's in Congress?" And there was certainly some similarities. Keith and I focused a lot more on cost containment and cost controls. But again, this was an issue that people just weren't ready for. But the fact is that we thought it was important to get it out there, to have that discussion. A couple of years later, Romney Care was introduced and passed in Massachusetts. And by all indicators, everyone, Republicans, Democrats, would call that a success. So again, maybe that's why we failed with that. Let me go on to a second, I'll call it again, a case study. And I want to focus on climate and California climate policy and sort of how we made this work. So you've heard of how we tried to do this on healthcare, didn't work. We tried it on climate and we were able to get it done. So just some background, Assembly Bill 32 was actually introduced in 2005. I served as the principal co-author. My main function in dealing with AB 32 was sort of keeping people comfortable with the market mechanisms that are in the bill. So it has a cap and trade system. So for those, you're probably familiar enough with certainly the concept of a cap and trade system for emissions. You set a cap on emissions, you lower that cap over time, and then you allow people to, you provide allowances. You say you can emit 100 million tons this year, but next year it's got to be 90, and the next year it's got to be 80, and so forth. And if you can't do that, you can trade with someone who might be able to do it more cheaply than you can. And the whole reason that markets work in this sort of system is because they sort of maintain the incentive structure that regulatory policy doesn't always maintain. So again, it was the first comprehensive mandatory greenhouse gas, GHG is greenhouse gas cap, again, permitted cap and trade. It said we had to reduce, and this was done in 2006, we had to reduce to 1990 emissions levels for greenhouse gases. We had to hit that level by 2020. And that was a big lift. That effectively meant that we had to find a way to reduce from where we were in 2006 and still grow the economy. And a lot of people at the time said, oh man, there's no way you're going to get this done. It's impossible. There's no way you're going to meet this target. And so I think it's important to sort of show what the results have been so far. And this shows on the y-axis greenhouse gas emissions, and it shows the emissions in tons of CO2 equivalent on this line right here. So you can see that you get to 2006, so AB 32 was passed and signed right here, bumped up a little bit. A big chunk of this, granted, was the Great Recession, where the economy took a big hit. But even after that, even as things recovered, we were able to keep this trajectory downward. And we actually met our 2020 goal 4 years early. So we were able to hit this total, this target of 431. Again, 431 is tons is what we emitted in 1990. And then we crossed over that again in 2016, and we're about 425 or so today. It's actually a little bit less than that today. So for whatever reasons, this was something that worked. This was a policy that we were successful with. So the question is, how did we get this done? Because, if you can, 2006, some of you were probably in 3rd grade or 6th grade, or who knows what you were, but you were young. But back then, climate had sort of made made its first serious appearance on stage in the US. Al Gore had his, movie and a book, and he did a lot of speaking, and a lot more people were paying attention to it. And so there were really three things that got us there. Number one, we had public support. Public support on global warming or climate change really grew over this time period. California had a really good economy, still does, even though we're still about 9 or 10% unemployment. When the pandemic's finished, we'll be down to 4 or so again. But our economy was actually good. And this chart here, this this shows just the relative performance of the California and U.S. economies over this roughly 20-year time period. And you can see I've indexed this to so you can sort of see the percentage change over time. So the California economy actually has done better, has performed better than the U.S. economy. And back during this period right here is just before that dip is when AB 32 was passed. And then the last reason is, we had a governor. That's not his official photo, as much as he would still like it to be his official photo. I'll use the official photo. So we also had a strong governor, a Republican. So I served 3 years. I was there for 3 years with a guy named Gray Davis, the Democratic governor, and 3 years with Arnold Schwarzenegger. And what I like to say to people is that Schwarzenegger was the best Democratic governor I ever worked with, because he's a Republican in name, and he's conservative physically and so forth. But on this issue, on climate, he got it, and he still gets it. So we were able to, even though we had a Republican governor, we were able to get this done because of these other things that happened along the way. He was up for re-election that year. I think that probably is part of his calculus, but I also think he believes this. And there are Republicans, there are not a lot of Republicans who push the climate issue, but he's one of the ones who did. So that's how we were able to get this done. How did we also, what sort of the strategy of this? We kept it really simple. The bill here that you see on the right, AB 32, there are a ton of co-authors, lots of co-authors here. So a lot of people supported this, but the bill itself is 13 pages long. It's really short. And, it's not thousands of pages. You've heard these things that come out of Washington, where someone, Nancy Pelosi, after when the ACA was passed, said we have to pass it first, then we'll read it, which was not the best thing to say probably. But it was easy to read a 13-page bill, right? Anyone can pick it up and read it in a few minutes, and you have a sense of what it actually is attempting to do. We delegated implementation. We didn't suggest that we as lawmakers knew exactly how to implement this. We just said, this is our goal, this is our target, let's figure out a way to make it happen. You guys figure out a way to make it happen. So we delegated the implementation to an agency here called the Air Resources Board, or CARB, C-A-R-B. And they've had a lot of experience with air pollution, natural fit for them. They've done a great job implementing this. Third bullet here, I mentioned earlier, it uses market mechanisms. That was really important to Schwarzenegger. He actually threatened, he said, unless you mandate market mechanisms, I'm going to veto the bill. Well, there wasn't enough support among Democrats. I would have been fine with that, frankly. But there wasn't enough support among Democrats to do that. And so we just suggested essentially market mechanisms. And within a month after the bill passing and being signed, Schwarzenegger created a committee that set up that cap and trade mechanism here. We also sort of made this big tent strategy, or built a big tent strategy. We didn't really make this about climate. We didn't really say, if you don't do this, the polar bears are going to die. If you don't do this, all sorts of horrible things are going to happen. What we said was, let's figure out a way that we can actually do this where it actually makes economic sense, where we can focus on the cost of emissions, where we can figure out ways that you can use technology to lower emissions and also lower your costs along the way. We also thought it was important to bring in environmentally justice compromised communities, I'll say, or marginalized communities, where environmental justice was a big issue. Because, you know, for the most part, burning fossil fuels leads to detrimental impacts very often in minority communities. And by getting those folks to buy into it, we made this a much bigger issue. We also made this, to a certain extent, about health. We wanted to make sure that people understood that their health would be better if we were able to find some way to you know, to reduce emissions along the way. Really quickly, because I know I'm short on time, plastics policy, I didn't really attempt this, but there has been some progress in this. I think this is kind of the next big environmental policy opportunity. We've banned single-use plastic bags in groceries, stores and retail stores. There was a bill in 2018, AB 1884, that got this huge amount of press. California bans plastic straws. Well, what it actually does, and Christine may remember this, California bans plastic straws in full service restaurants where you're greeted by a host or hostess, taken to a table, served at the table, get the ticket at the table, etc. So it'll, you know, it sort of exempts almost everybody from this. It really doesn't do much good, unfortunately. But there is an effort today, Senate Bill 54, to actually reduce, recycle, or compost 70% of our plastic waste by the year 2032. Now, some of you may say, wow, 2032, that's a long time away. Maybe there's a way to move that up, but this is a huge political lift because you've got economic interests that are lined up against this. So how do you get this done? Well, maybe you put it on the ballot, which is sort of the backup plan. People are talking about putting this on the ballot in 2022. If the economy's in good shape, there's a good chance we'll be able to pass that. All right, so real quickly, environmental climate policy. So some of the science, I do an entire lecture in my Yuan biology course here, and I teach a climate policy course as well, in which I go into much more detail of this. But, you know, I like to show this graph to people and say, do you see a trend? Do you think there's a trend here? And, you know, this is in Fahrenheit. As one of my colleagues would say, that's so embarrassing that someone would use Fahrenheit instead of Celsius. I apologize for that as well. But that's where the chart is, because it's a US chart. It's from NOAA. But you can see here, I mean, you have a pretty good sense over 100 years, you know, we're up about, it's about 1 degree Celsius. And the question is, you know, can we keep it to a couple degrees Celsius from where we are today? It's going to be a really tough thing to do, but we need to do that. So that's, you know, that's that. Sea level rise is pretty minor so far, about 8 inches or so, relatively small. But again, the future suggests it's going to be much worse. I like to always emphasize the CO2 rate of increase. CO2 is the, you know, is about 80-something% of all greenhouse gases on the planet. And what's really scary about this is that if you look at this, again, this is from 1959. This is when we start collecting CO2 data out on Mauna Loa and the Big Island of Hawaii. So first half of that period grew at 3.5% per year. It's been growing at 5% per year. It doesn't look like it from this chart, but if you do the math, it's 5% per year. And so it's probably going to be, you know, if you were to take this out another 20 years, it might even be higher than that. Hopefully that's not the case. But again, you know, going forward, you can sort of see what the future looks like in terms of greenhouse gas emissions. Because of the emphasis on health, and again, I think it's really important to focus on health when you talk about climate. We know there are going to be these enormous impacts on human health. Migration isn't specifically, or actually no, it is. Forced migration is here on the chart. Forced migration, the estimate is that about 1 billion people will be forced to move over the next 30 years because of climate change. 1 billion out of 7.5 billion that we have today. There'll be more vector-borne diseases, all sorts of other things. There's a clear correlation between higher temperatures and higher violence, higher temperatures and suicide rates, and so forth. And so, again, I think the way to do this is to focus on health. air pollution, another thing that we can focus on as well. So one thing in particular I want to emphasize, and this is a really neat study that was just done out of Stanford about a year or two ago, and it shows that fossil fuels increase dementia. We know fossil fuels lead to all sorts of negative environmental impacts. We don't know the biological pathways specifically on this, but we know from this research, early research, that a 10% increase in particulate matter, 2.5, that's particulate that's 2.5 microns or less, typically found in, when you burn a fossil fuel, increases the probability of Alzheimer's or related dementia by 1.7 percentage points. It's twice the impact, twice the risk from hypertension. And when you tell people this, they typically, even right of center political groups, they'll say, hey, maybe I should care about this. Maybe this is important. If, because virtually everyone knows someone who suffers from dementia or knew someone who suffered from dementia. So again, I think it's really important for us to make that connection to health. So the environmental health connection is really apparent. Where are we going to get there? Just really briefly on the Paris Accord, and this gives you a sense of what the Paris Accord will do, might do. If we don't do anything, we're going to be about here, which will raise the temperature about up to almost 5 degrees Celsius. Catastrophic for the planet. And when I say catastrophic, I mean that in terms of disrupting ecosystems and so forth. Again, most people believe we need to keep it to 2 degrees. If you can find some way to, meet the Paris goals, look at this, Paris doesn't get you there. You still get to 2.4 to 2.7 degrees Celsius increase from today. And that's if everyone does what they say they're going to do in Paris, and not everyone's doing what they have pledged to do. So this meeting this November in Scotland, when the UN convenes annually, the last year's one was obviously postponed, is really important to get people to sort of step up, recommit, which the Paris Accord actually calls for. So will it help? It moves us in the right direction, but we've got so much more to do after that. So I think it's really important, again, and I think Biden has done a really good job on this so far. His infrastructure package is coming next week. It's not going to be so much about about climate, but it really is about climate. The transportation part of it is about climate, because generally across the country, and virtually, I think in probably every state, transportation, because of the burning of fossil fuels, is the biggest contributor to greenhouse gases. You can move to, if battery storage will help us a lot across the board. Electric power plants will be able to convert, and we'll have solar and all sorts of other things that are cleaner burning. But again, you need to find some way to sort of frame this as a health issue, an economy issue, an infrastructure issue, an equity issue. And if you do that, I think we'll have a kind of this big tent strategy we used with AB 32 that I think worked pretty well. I will end it there. I went a little bit over. I'm sorry for that. And that's my contact information. Would love to take questions. And thanks again for inviting me. Appreciate it.
Thank you so much, Joe. We really appreciate it. Thanks for putting that all together for us too.
Sure.
So now is the Q&A session. Before we begin, I just want to let you know you'll be getting questions from multiple areas. So I'll be handling all the questions on the Zoom, in the chat, and then also Garrett will be fielding questions that are coming in from the live stream. And for those who are watching the live stream, if you want to submit a question, you can submit it to the email above Garrett's head, environmentalstudies@ou.edu. Okay, so we have a few questions so far. So the first one from the chat is from Wes Honeycutt. Question to be asked. Dr. Nation makes an excellent point about the 3 strengths, which allowed AB 32 to pass. Oklahoma is 0 out of 3 on those. What are we supposed to take away as a state without those boons?
Yeah, I think it's much tougher there. But I guess I would there will be some states where it's just not going to happen. And that's why it's even more important to have a federal framework and a federal policy. And I think if we can find a way to get that federal/international policy, that will include Oklahoma. I mean, Oklahoma is a big oil and gas state. I know that. But I also know that, and I've got slides on this, obviously. If you look at the cost of generation for oil and gas versus, say, large scale PV photovoltaics, guess what? The photovoltaics, either win or come very close to winning. And so I think the economics will be such that even places like Oklahoma or West Virginia or Wyoming, there was a great article in the New York Times about a week or so ago on how Wyoming is shifting away from this emphasis on coal, and they're building wind generation facilities. And I think the economics will sort of bring states, that are redder along in the right direction. That's my best short answer on that.
Thank you.
Mm-hmm.
I have another question from the chat, unless Garrett, you have any so far?
I do not have any at the moment, though I do want to announce that the sign-in sheet for Outro purposes should be live now.
Thank you, Garrett.
For
okay,
sure.
Here's another one from Austin McCauley. It's a bit long, so you can get along with me if you'd like.
Okay.
Perhaps I'm wrong here, but my impression of the Democratic position on single payer has been steady opposition outside of the relatively small, in terms of elected officials, progressive wing of the party. Many of California's current major Democratic representatives, Feinstein, Pelosi, and at various times when she's actually held meaningful power, Harris, are opposed to single payer. And my understanding of the ACA debate was that simply having a public opinion mixed in with private options was treated as being progressive pipe dream at the time.
Mm-hmm.
That leaves me a little unclear on how the Democrats have been obsessed with single payer. Is the California political picture significantly different than the national one in the DNC with regards to single payer financing?
So I think that this is sort of back to that virtue signaling comment I made earlier. There are 80 members of the Assembly, 50 something Democrats, and there are 20 something Democratic state senators here. So about 70 something, say 75 total. If you were to go to them today and say, are you in favor of a single payer system? 62 to 65 would say yes, of that number. Then you'd say, okay, well, how are you going to get there and what's it going to look like? And they would say, well, I'm not that worried about that. I just know that my constituents want single payer. And so there's never been an appetite, from what I've seen, with a few exceptions. The governor here is one of them. The governor is a policy wonk. There hasn't been an appetite among Democrats to actually do the hard work and do the math, do the financing, look on the benefit side and so forth, to actually come up with a plan that's doable, that they could actually enact. So I will point to one case in Vermont where, Bernie Sanders' home state, where they actually said, single payer, we're going to do it. And they passed the bill and the governor signed it. And 6 months later, they said, this is impossible. We can't do it. And they gave up. And they gave up because they hadn't thought about the potential loss of federal subsidies. And again, I think a single payer system could be okay, but it depends how you structure it. I frankly prefer I prefer a regulated market system, like you have in Germany or like you have in the Netherlands. I think those work better. I think they fit more with the culture of what we have here. And if you look at those countries, they actually keep their costs down. They actually have pretty good performing systems. It's interesting, Bernie Sanders, I just mentioned him. Bernie Sanders put out a tweet about 2 or 3 weeks ago, and he said, these countries around the world have better healthcare, childcare, et cetera, than the US does. And of the 10 countries he listed, number 8 and 9, this is in the rank order, number 8 and 9 were the single payer countries. The first 7 had regulated markets. And I kind of thought, well, does Bernie not know that? Does he not know that these are regulated markets, not single payer? So again, it's a great soundbite. It's like on the right, it's like stop the steal. It's like whatever, it's, single payer or die. And, the facts are, you could make a single payer system work. Canada has made it work, but there are costs of that in Canada. They kept the financial costs down, but they got there by rationing. And I don't think Americans are really culturally ready for that sort of a system. I think people here still want more independence. They want more individual independence and opportunity. So I think, anyway, that's a longer-winded answer. But I do think that if you poll Democratic legislators, in Congress or virtually anywhere, 80% would say, I'm for single payer. Would they do it? Would they actually vote for it? Probably not, because they know it wouldn't work. But I'm being cynical.
Thank you, Joe. And Austin, I'll send you a link to the Kaiser Family Foundation statistics that takes a public poll on Medicare for All. And it does show that with regards for public opinion, that's then stratified by party lines, who prefers Medicare for All. And hopefully that'll help answer your question as well. And it's also noted from Joe's slides. So another question we have is from Jay Patel. It says, how prominent is nuclear energy in the US, and is there a plan to expand it?
It's interesting. I just got an email from a colleague of mine. He's an emeritus economist at Stanford, super smart guy. And he said that he wanted my help in designing some energy policies, decarbonization policies for California over the next 10 years. And he listed 4 objectives. And one of the objectives was kill nuclear. I've sort of evolved on this. I mean, actually, when I was in office, someone said, would you ever support nuclear power? And I said, over my dead body or something like that. I think honestly, I'll take the Al Gore position. I think it has to be on the table because, because I think it's better than burning fossil fuels, without a doubt. But having said that, there's plenty of evidence that we don't even have to go down that nuclear pathway, that there are other ways that we can satisfy the energy demand that we have, and across the world we have, with renewables. We need to put more effort into renewables. I mean, Christine, you remember this from some of the bio lectures that I did. The subsidies for fossil fuels in this country still exceed the subsidies for renewables. That's just nuts. It's 2021, and we're still subsidizing fossil fuels at a higher dollar amount than we're subsidizing renewables. And so if we put that sort of effort into it, into renewables, I think we could find a way not to support nuclear power. I do think it needs to be part of the discussion. I mean, if I were in office, I would at least have a discussion about it. Don't know where I would land, but I think it's better than the alternative with fossil fuels.
And do you happen? Oh, sorry.
Oh, no problem.
Sorry, Garrett. Joe, do you happen to know if there are any states that utilize nuclear energy in the U.S. right now?
Oh, sure. California does.
Oh, they do. Oh, okay.
Yeah, California does. There are some that do, but no one currently really is willing to take the risk. Huge capital cost, huge long-term cost. When Harry Reid was the head in the Senate, he blocked every attempt to, for some sort of a long-term storage facility in Nevada, which I understand. If I lived in Nevada, I probably wouldn't want nuclear waste in my backyard either. So, you know, there are states that do this. There are countries that do. The French, the French would say, I mean, the French, if you look at their numbers, their greenhouse gas emissions are really low. It's because of nuclear energy. The question is there an alternative to nuclear? And again, there's a guy at Stanford named Mark Jacobson who does a lot of work on this. I mean, he would argue, hands down, no question, we can do it with renewables. We don't need nuclear.
Cool. Thank you. Garrett, did you have a question?
Indeed, I do. Yeah, and I think there might be an issue with emails coming in, and if so, that sorry to anyone whose question is not getting fielded right now. But at any rate, there was a question about using this appeal to justice that I think you had mentioned previously for gathering popular support. I'm not sure if that's in regards to environmental or healthcare policy or both, but it's relevant to both. So the question is essentially, do you think that appeal to justice works to bring on both the disadvantaged, people, as well as the more privileged groups, the more privileged stakeholders?
Yeah. I do, because I think, I mean, I can't, it's been so heartening the last year to see the focus on not just environmental justice, but on equity overall. It's, I remember my kids, I have twin daughters and have these, who are 31 now anyway. And I remember having a conversation with them, and this was after George Floyd was murdered. And they said to me, do you think this is going to change? And I said, yeah, I think this is different. I think this is different. You've got people who look like you and me, out in the street protesting in the middle of a pandemic. This is different. People get it. And so, so I think there's been something that has shifted. I can just tell you, I mean, I know Stanford's in a little bit of a bubble. I mean, certainly I hear that from the students at Stanford, but I hear it elsewhere across the state. So I do think that there is, I don't know. I mean, so much of this depends on young people. It depends on people in your demographic actually being engaged and and working on this. But I do think that the tide has shifted on this, and I think it can be effective in getting people from those affected communities and non-affected communities who are finally saying, hey, you know what, this isn't right. This isn't fair. So I mean, I'm probably more optimistic about that than I've ever been in my lifetime, honestly.
Awesome. Thank you for answering that.
Sure.
I think we started a little bit late, so I think we'll go a few minutes. If anyone needs to leave, go ahead, absolutely. But Christine, I think you had a couple more questions.
Yeah, is that okay with you, Joe? If we have,
Sure.
I think there's one more question. And this one's a little bit broad. It is from Farouk Mystery. I apologize if I get that incorrect. Their question is, I would like you to share your experience / lessons learned in persuading various stakeholders, community regulators, decision makers, in identifying a policy that could be enacted into law. Thank you. Which is
yeah. I mean, I think the way to get to move people is to, there are really two ways, and you can sort of appeal to people's good nature, and you can say, hey, this isn't right, this isn't fair, and why is it that this community has a power plant in their backyard and you don't? Sometimes that works, in some communities that works, but I think that the thing that I typically do is I try to sort of build or paint a broader picture, where I actually say, look, everyone will be better off. You will be better off, even though you may not be directly affected. And you're going to be better off because guess what? We're going to have lower healthcare costs. We're going to have lower rates of cancer. We're going to have all the, these other co-benefits of the policy. And I think that, that I think that generally works. The other thing I do is and this is a little bit goofy, sorry, but I actually will try to take this down to an individual level. And I will actually say to someone, there's a 5-year-old Hispanic kid in this community who's being exposed today to air pollution. And we know the science, the medical evidence is clear that the odds of that little kid growing up and having a disease or having a heart attack or, whatever, hypertension, because of that experience as a 5-year-old, we know it's significant. And it's not fair to this 5-year-old boy or this 5-year-old girl. So, I try to make it sort of take it down to that level. I remember real quickly, quick side note or sidebar. There was, I think it was my second or third year in the assembly where we had this, dot-com bubble burst. And so state revenues fell. We had, we were having to do all sorts of budget cuts and so forth. And one of the things the state does is the state supports, provides support for people who are generally people who are slightly disabled, but who can still live at home fairly independently. There's some additional support that's provided in home support services. IHSS is the name of the program. And the governor had proposed this really big cut in that IHSS program. And, it's kind of a tough call because you say, well, you got to cut somewhere. Where do you cut? Do you cut schools? Do you cut this? Do you cut roads? What do you do? And I remember a woman came to my office. I met with her just one-on-one. And she said, she told me about her son who was developmentally disabled, who lived by himself independently, but could only survive with that state support. And at the end, of course, she says, what are you going to do? And I said, I'm not sure. I really appreciate you taking the time. And she said, you know what? I want to leave you with something. And she took out a picture and she said, this is my son. Before you vote on this, I want you to look at this picture of my son. And I want you to remember that he's going to be hurt by this. And I know you've got a tough decision to make, but he's the most vulnerable in our population. And I took that picture and I put it on my desk in the assembly chamber, and I kept it there until we voted, and I voted no. In great part, we worked out a deal to find, other ways to, to move money around and so forth. But that had a huge impact because that was about one guy, one person. So I think that can be sometimes just as effective.
Thank you, Dr. Nation.
Sure.
I believe those are all the questions on my end. Garrett, do you have any more?
No, I do not. No, I do not.
Okay. All right. Well, then I'll just kind of wrap up a little bit, if that's okay with you, Joe. First of all, I want to thank you all for joining us today. All of our audience members, thank you all for your really great and thoughtful questions as well. Thank you, Dr. Trachtenberg, for helping us put this together. Thank you, Garrett, for co-moderating with us and fielding questions from the YouTube channel. And most importantly, thank you so much, Joe, for giving us your time. I know you're very busy and you have a lot of Lake Tahoe to see today, I'm sure. And we are very lucky to have your perspective. And we also, even though you represent California, we know you have Texas roots, and understand the perspective of most Oklahomans as well. And even though there are differences, it's still very valuable for us to have your perspectives and your experiences for us as young people going forward, for those of us who might become physicians one day, or also lawmakers too, and or all of your advice is very helpful. So thank you very much.
Thank you. And if in the future there's a chance for me to come and visit you guys in person, I will not wear my Longhorn sweatshirt. How's that?
I think that'll do.
You'd appreciate that.
Okay.
Perfect. Okay. Oh. Okay, thank you.
There I am. I'm not, okay, someone muted me. Anyway, thanks very much. I really appreciate it. All right, you guys go out and do good stuff. I know you will.
You too.
Thank you. Okay, bye-bye.